Hey, it's Patty. In this presentation, I am going to talk about just an introduction to treating mast cell activation syndrome. And of course, with my background, it's from the perspective of considering a connective tissue pathology. But really, this is just like the general reason that we go about treating mast cell activation syndrome when we first see it in an individual. For the most part, and again, individualized treatment might look very different, but as I tell people that I work with, we typically talk about this general treatment strategy. If you seem to have the diagnosis, we treat the diagnosis first and then maybe see how you respond and then create an individualized plan for you. So in this presentation, this is really the generalized plan. Like, why would we do certain things? What are the things that we'd want to do if we did see that there was an abnormal mast cell activity in an individual? So these are kind of the things that you would want to go through at some point to figure out with somebody that has abnormal mast cell activity. We definitely want to educate, talk about trigger reduction, maybe some pharmaceuticals, dysautonomia interventions as well. There's herbal and natural remedies that do work for a lot of people, especially if we're talking about long-term management strategies. And then we'll talk a little bit more as we go through about possibly going down the rabbit hole of underlying infections, chronic inflammatory drivers that can be altering the mast cell activity that's occurring. But education is really important. I tell people that I work with, at some point, I'd like you to know more about your condition than I do. I'm just here as a guide to figure out how we got here with your presentation and then how we get you out of it and give you all the tools to be able to manage, hopefully for the rest of your life, stopping in if needed to figure things out, of course, with a professional. Trigger reduction can be extremely helpful. It can also be really difficult for a lot of individuals depending on what the trigger is. And I go through more on specific triggers that are out there in my separate what is, mast cell activation syndrome talk that we have. But it sounds easy, right? Especially as a provider saying, "Oh, just reduce your triggers." But if your triggers are the stress that you're currently living in, and it's not an easy solution to get out of, then we may need things that help with reducing symptoms like pharmaceuticals and other management strategies until we can figure out how to reduce some of the not so easy to reduce triggers, right? But there's more information about what those triggers might be in the MCAS in general talk that I gave. Pharmaceuticals can certainly be helpful. I think we talk about pharmaceuticals as a first line of defense, and that can be super helpful for a lot of people. And I think, especially in acute situations, it's very practical. But there are a lot of other ways to go about this as well. So if pharmaceuticals has not worked for you as an individual, there might be other things to try. So the way that the mast cells, when there's degranulation that happens and causes a mast cell type of event or activity, we have this release of neurotransmitters, but then it gets caught in this vicious cycle where we have the nervous system basically responding to mast cells or the immune system, and it just keeps going. So it doesn't really matter who the chicken or the egg was in this scenario. We can have this mast cell presentation and the neurological presentation of dysautonomia, some sort of abnormal regulation of the autonomic nervous system as well. So sometimes backdoor treatments for dysautonomia, which also have to be specific to the individual, but they can actually be really helpful. And we can't forget that when we're talking about the immune system, that sometimes working on the nervous system can actually help stabilize those mast cells as well. So don't forget about that if it hasn't been tried before. And then herbals, natural treatments, we're going to go through some of these in the talk today. And those can really be helpful, especially for long-term management strategies, possibly a healthier option if somebody does need to take something daily to stay on an herbal that works for them, and that's very individualized versus possibly a pharmaceutical. And again, everybody is very different. And then a rabbit hole, and we're going to talk about this a little bit, but the rabbit hole is, why are your mast cells acting abnormally? So we can blame it on connective tissue in general, but there's typically something that also riles up the connective tissue from an immune system standpoint. So if resetting the mast cell activity through some of these interventions just resets the system and everything seems hunky-dory and you seem to be stabilized and don't need further treatment after you've done, like, a round of 3 to 6 months and you've reset yourself, then that's great. But if it seems like it hasn't, or you've plateaued, or maybe you can't get off of those things and you don't necessarily want to take things normally daily, then we might want to think about this rabbit hole of why would your mast cells be continued to be aggravated? So is there any underlying infections, chronic inflammatory drivers that would need to be looked into with a specialized professional that understands the immune system and the role of the mast cell specifically? So to start out, because I feel like this is where we start with a lot of people, pharmaceutical management, which is, I said, absolutely fine. I actually have a lot of people that just know that they do well or better on pharmaceuticals compared to plants and herbal remedies and supplements. If you know yourself, then I trust you more than my opinions on things for sure, right? So we have this pharmaceutical management that has like a three-tiered approach or a three-prong approach as the first line of defense. So the first line of defense is, and I'm going to do this in a little bit different of an order so I can kind of explain the why we do this. The first line of defense is typically using a mast cell stabilizer, using something for mediator control, and in this specific example, it's an H1 and an H2 antihistamine, and then vitamin C. Typically, the first line of defense includes all three, and I'm going to break this down so that you understand why we would want these layers in there. And sometimes it works, sometimes somebody can get all three in, and sometimes it just doesn't work, and that's okay. That's what individualized treatment is for. And then this article just points out, hey, there's other things. Don't give up. If it doesn't seem to work, there's actually a lot of other things to play with. And as I go through why we would treat certain things, hopefully you can see that there's actually a world of possibilities to try for mast cell treatment. So when we talk about mast cell stabilizers, there is holistic stabilizers that are out there. So this is actually, I think, out of my book that I did, the Taming the Zebra, but just some ideas, and not all of them. I'll show you a little bit longer of a list. But quercetin, we talked about a lot. Quercetin is in the literature that can help stabilize mast cell activity and is typically benign for a lot of people like everything else, right? So it's not necessarily for everyone, but as something that's benign in many, it might be a place to start. Quercetin is something that you can get over the counter. Cromolyn sodium is a prescription, but it works a little bit on par, as to the effects with quercetin itself. But then as more of a mast cell stabilizing standpoint, we have vitamin C, something called bromelain, resveratrol, melatonin, and actually CBD as well. So there are other options. I always tell people, look, if cromolyn doesn't work, if quercetin doesn't work, we can regroup. But it would be nice to have a mast cell stabilizer. So again, other stabilizers out there. With the three-prong approach, having a mast cell stabilizer works on the communication of the mast cell. So when there's abnormal mast cell activity, it's because the mast cell is sending out the wrong signals, and it might be saying, hey, do too much over here and don't turn off. So it's a communication problem from the mast cell. So taking a mast cell stabilizer will help with the communication piece. And this is where it can be a little bit difficult to tell if this is working because it controls reactivity. So that would mean that in order to tell if this was really working for you, and some people can take it and they're like, I do feel a little bit better. But a lot of people don't know until they forget to take it and they're like, oh, shoot, I guess it was doing something. Because remember, it normalizes reactions. So a mast cell stabilizer is typically under the radar. It's not like your body says to you, hey, did you see that? I caused less of a reaction. Aren't you proud of me? So mast cell stabilizers might not be as obvious if they're working, but it's part of the layer. And again, we need something to help control the communication piece. So that's what mast cell stabilizers are for. First part of the layer. These are just other types of mast cell stabilizers. And of course, you wouldn't take all of these, right? But it's just an idea of some other things that are out there that could be helpful if some other things aren't working, right? And this, you need to talk to a specialist. If you have certain sensitivities, don't take that certain thing, but there might be some other things to play with. And this is the second part of this list. And what you'll see in the next few slides is bits and pieces of handouts that I actually give people on, which is at first very overwhelming, but then it becomes a nice reference as people start to learn about how their body reacts to certain things. Um, options are great. And I know a lot of people, when they see all this, they get excited at first and then they're like, well, I have no idea what to use. So working with a specialist or a nutritionist or an herbalist to possibly pick out the right ones for what your body is doing as a mast cell stabilizer, things that have worked for you before, things that seem safer for your body could be helpful. So again, it's really trial and error and figuring out or learning from your past as well. Like, hey, I have actually done really well with thyme when I've tried it, or turmeric. Then you might want to start there and decide to branch off in experimentation later. So options are great, but they can seem overwhelming. So again, if we can narrow it down to only trying one at a time, then we really know what might be working for us. So from a pharmaceutical standpoint for mast cell stabilizers, we have cromolyn. Cromolyn actually comes in a variety of different forms. So oral form, a lot of people know of cromolyn sodium or gastrocrom that works internally. But as pretty sure it was Afrin that was talking about this a while ago, and maybe still does, put it where you need it, right? And I think that might have been in his Don't Bet Against Occam book with nasal crom, that if they're seeming to have more of the mast cell type of reactions in the upper respiratory passages and maybe neurological brain tissue related, that maybe we use it as a nasal spray, which is interesting because nasal crom is over the counter. And then Opticrom is a prescription, so you would have to get a prescription from a doctor, but that's cromolyn sodium eye drops. So if you feel like you're having a mast cell reaction at the level of the eyes, something to talk about with your provider. And then you can put it where you need it. So cromolyn sodium can be used as a rinse, a wash, and there have been studies about using this as a vaginal wash as well. And then being put into creams for topical use. So just something to consider, cromolyn sodium. For herbalists out there that might be thinking, oh, wait, you can put a mast cell stabilizer in a topical type of lotion for somebody. Yes, you can. You can use things like coconut oil, oat, and things like neem or moringa, and put it in there and actually make like a mast cell stabilizing antihistamine topical based on what the patient seems to respond well to. Ketotifen is actually a crossover between a mast cell stabilizer and also an H1 blocker. And there's some other ones out there too that aren't as commonly used, and they're not all on here, obviously. There's a ton of different mast cell stabilizers that are out there. So the second layer, stay with me for those of you that are triggered by seeing vitamin C in the same talk as antihistamines. Hold on a second, because the body is, we know this, more confusing than we think, right? We actually need vitamin C to make something called DAO in our body. Okay, so DAO actually reduces and stabilizes internal histamine reactions, but the body needs to take in vitamin C, break things down, and then use it to create other things like DAO. So over time, vitamin C can actually work like antihistamines internally in that way. So for those that think I can't take vitamin C because it's high in histamine, just stick with me here. It also aids in collagen repair too, vitamin C specifically. So for our connective tissue population, it seems like a good double whammy for treatment, right? Um, Now, most vitamin C supplementation comes from corn. Okay, so the reactions that people are having actually might be corn related because they use the ascorbic acid from corn because we have so much corn. And it might not actually be a histamine response, but a corn sensitivity. So there might be other ways to get vitamin C in without corn as a supplement that could be tried for some individuals, or other ways that are less histamine based. So like using magnesium ascorbate, something called camu camu, and then these foods that are listed here are higher in vitamin C and typically lower comparatively. There's no such thing as no histamine, but comparatively to some of our other fruits and vegetables that we think of. But there's a food list in case anybody wanted to experiment if they felt it was safe. So I know that there's a lot of talk about vitamin C being high in histamine, and if that really resonates with you in your body and you've had bad reactions, obviously don't take it. But just so that people understand, don't brush it off right away. There's more science than just the front load of histamine within vitamin C. Usually, when we say take vitamin C, It's usually at about 1,000 milligrams a day for a lot of people, but there's this range like 500 to 2,000. Sometimes I've also seen this in much, much larger doses prescribed by specialists and for a certain time period, right? So just know if you're looking at increasing the dosage of really anything at all outside of what we typically think is our daily norm, please talk to somebody about that. Do not do that on your own. You would want to be monitored. And then we have this cool thing with vitamin C that sometimes it can actually help with that estrogen problem that's happening with cycle changes. So with certain individuals that seem to be reactive to their own period, like 3 to 5 days before my cycle starts, I know I'm going to start having these reactions. Vitamin C might actually help, and that's where we take that kind of that standard dosage of 1,000 milligrams, and we'd increase it to maybe 2 or 3 grams each day until the period starts. So 3 to 5 days before, about 3 grams. And then when the period starts, you can come back down to your normal dosage. And there's actually quite a few people that respond very well to just using vitamin C. Vitamin C is water soluble, so it is recommended that if you're going to take vitamin C, that you take it in smaller doses throughout the day rather than these big, large doses, because you're probably going to excrete most of that rather than actually using it for benefit. So using it in something like a drink mix that you can sip throughout the day, or just taking smaller doses if you're okay, and taking multiple doses of things throughout the day. Okay, and here's where, if it wasn't complicated already, this is where it should become complicated for individuals, is treating the mediators, right? And this is where we individualize treatment, because everybody's tail end of the activity is going to look a little bit different. That's why some people have eye reactions versus skin reactions versus GI reactions. It's really important to know what mediators we're trying to treat. Okay, so just a reminder, this is in my other talk on the general introduction to mast cell activation syndrome, but there's other mediators out there. We talk a lot about histamines, but there are hundreds of different mediators in the body, and how we treat them is actually differently. So yes, we talk about histamines a lot, and I'll talk a little bit about antihistamines as like the treatment for it, but that's what we hear in the layered approach, right? Like, oh, we'll take antihistamines. Yes, actually, histamines do cause problems for a lot of people, and it can be very helpful to take antihistamines. But if prostaglandins are your main problem, we just want to make sure that we're giving you precise treatment, right? Or that you're getting precise treatment. So again, you really want to talk to somebody that really is a mast cell specialist that understands. Sure, maybe first round we go for the general antihistamine approach, but if it's not getting rid of some of your symptoms, then maybe we take a look again and come back and regroup and refocus where you're still having your symptoms. Again, this is just a review of some of the symptoms that we might see, or like stronger presentations depending on the mediators that are involved in a certain individual. This is talked about again more in my other talk on the general presentation. Okay, so back to the antihistamine talk, because I know there's so many people out there that are put on cromolyn, sodium, vitamin C, and then boom, here's your H1, your H2 blocker. Have a nice day. Good luck to you. This should work. It should, but remember, that's treating a diagnosis and not a person. So if that is how the approach starts, that's great. Good experimentation. Now what? Did it work? Did it not work? Did it work on some things and not all things? So again, histamines is just part of the picture. So an H1 blocker is typically used for what we call like more systemic type of reactions, where an H2 blocker might have more effect on things that are happening in the gut. And I have seen in individuals that are prescribed much larger doses than what we think the standard dose is. So if you are on the higher end of mast cell reactivity, make sure that, again, you are seeing a specialist that might be able to shift medications for you. I'm not going to go through all of these, but actually, it's my little writing down there that's more important even than the medications that are listed here. But just understand there's a lot of different ones out there. Also, antihistamines typically, because we're talking about individuals that are abnormally reacting to things, right? Like, we don't want to challenge the immune system anymore. We don't want to give somebody more treatment than they need. We want to be precise, right? There's so many things going on, then I always say less is more, especially in the beginning. So if we can focus on what we're trying to get at, and if we don't get at it, move on. So really, if somebody is given something for the mediators, and I said before that the mast cell stabilizer really is under the radar, treating the mediator, the things that are pro-inflammatory in the body, you should feel a difference. It's not like a mast cell stabilizer that might feel under the radar. Treating the mediators in 2 to 4 weeks, you should say something is different. You might not have words for it, but you should say, I feel better in some way, right? So if whatever the person is taking is not making them feel better in 2 to 4 weeks, you need to have a talk with the medical provider to see if there is another option. Maybe there's something that might work better for you. Everything has a different formula, right? So we just want to make sure that we're not staying on something that's not helping. Okay. Antihistamines from an herb standpoint. Again, this is just kind of collections from what I give out to individuals as recommendations or options or things to think about. Again, this is not telling somebody to take everything on this list, but just other options. If somebody seems very reactive to pharmaceuticals or the fillers that might be in them, there are other options out there that, again, herbalist, natural medicine provider, some sort of functional medicine, or even there are some naturopaths, immunologists that can make recommendations for these as well. And the end of my list for antihistamines. And you'll start to see that there's some crossover between things that are mast cell stabilizers with herbal properties anyway, and some things that also treat histamines and maybe leukotrienes. So rather than thinking, oh gosh, I have things in a lot of the different mediators, I have to take one thing for everything. Herbal wise, there might be a few things that cross over. So that's why it's kind of good to cross-reference and see what might work well for you. And just a note, turmeric pops up a lot on these lists, but it's really important to know that that turmeric, it does interact with many different medications. So if you are on medications or multiple different herbs and supplements and you're thinking about taking turmeric or are already on it, please make sure that you cross-reference everything that you're on with turmeric, because again, we want to make sure that everything is working efficiently and not overworking or underworking because of something else that you're taking that you thought was helpful. Also, a note on quercetin that I just thought of as this came up too is I have had feedback from some people that say, oh, well, there's this article came out that said quercetin is bad for your thyroid. And if you read the article, I believe they had those individuals on 4,000 milligrams of quercetin per day for a number of months, which is nothing that I think I've heard being prescribed at any point. So yes, too much of really anything is not going to be good for the system. That being said, with quercetin, if you do have an issue with your thyroid, it might be something to talk about with your medical provider just to have it monitored to make sure that you are at the right dosage and it's not affecting those other issues that you're dealing with as well. Okay, there's this group, leukotrienes. Again, I talk about more like these different mediators and where they might pop up and what you might feel. Leukotrienes may be a little bit more respiratory biased with reactions. So those sort of things that work on leukotrienes or mast cell stabilization within the respiratory passages as an herbal option are these that are written here. And again, there's probably more out there, but this is a collection, and this is from my herbal studies and also Amber Walker's book, Mast Cells United, that has some of this information in there as well. And then we have prostaglandins. There's other things that work on prostaglandins. And again, less is more. So this is not to tell somebody to throw in medication for every single thing that's in there, but the prostaglandin piece, the pelvic inflammatory piece, if we feel that like that is a main issue for an individual, then maybe we start with something for prostaglandins rather than antihistamines, right? We can always go back and add things in. And there are a few things to use for prostaglandin support. Now, I do have in parentheses here, bromelain is one that is readily actually suggested for a lot of different conditions. It does seem to work very well. But a note on bromelain is that it is pineapple based. So believe it or not, there's actually a lot of people out there sensitive to pineapple. Please don't take something that you feel you might be a little bit reactive to just because you think it might help something else. That's a really tough decision to make, and especially when you first start treating things, you really want to try to not bother anything else in your body. So my second one that is a go-to is typically that red ginger or galangal. But again, all of these have some sort of prostaglandin activity. And there's some crossover too. If you're dealing with SIBO and prostaglandin problems, maybe you think oregano because it actually works as an antibacterial for the gut as well. So again, finding a specialist that can put all this together for you can be really helpful. Okay, but there's more. Again, this is from the list that I usually hand out to people just to show them like, hey, there's a lot of options there. There's a lot of things that you can talk about with your medical provider. I'm not going through all of these, but there's a lot of these are kind of backdoor or indirect treatment strategies. So even LDN, LDN actually helps stabilize the neuroimmune response when you and mast cells. It's the immune system, and we have the dysautonomia part of it. That's the autonomic or the neural piece, so the neuroimmune system, if that's being stabilized by LDN, you actually might help subdue some of the mast cell reactivity and the autonomic overdrive that might be happening. Okay, so there's a lot of other things to potentially try for individuals as backdoor strategies. And this is just a little bit more for my providers, but for any individuals out there that do work out or go to places or looking for other suggestions, this is typically when I talk to providers. I'm like, hey, don't forget that your clinic might be a problem when we're talking about mast cell issues because of odors and scents and friction and things like that. So from a treatment standpoint, you still want to avoid things that are irritating. And again, I'm not going to go through all the different triggers, but if we're using sprays or products that can be inhaled, don't use them when those individuals are in the clinic. Or talk to your therapist or your rehab professional or your doctor's office to just say like, hey, like when I come in, would it be okay if you didn't light the candle? Or try to set it up in a way that's a little bit less reactive to you as a patient or to your patients as a provider. And again, reconsider odors. I know there's a group across the way that's a health and wellness center that sages their office every day, which I love sage. Not everybody does. So you have to make sure that it's well aerated or that you have a filtering system that's set up that helps get those smells out of the office. But that can be really helpful is to have a conscious office or a conscious living space that really gets those odors out for you or doesn't bring them into the space at all. Latex-free bands are helpful if you're doing physical therapy. And again, physical therapy related because that's also one of my backgrounds. Using free weights rather than bands sometimes, and it's really person dependent, right? But the bands can on individuals that have the mechanical pressure sensitivity, where they break out in like the strawberry type of high V rash, or like petechiae after holding or having friction on the skin, then we might want to use free weights rather than something that's going to pull and torque the skin on the top. And also to consider for treatment, a little off topic, but still like might be a great treatment for a lot of individuals that are dealing with altered immune systems, right? Is lymphatic work. So, and I would suggest if you're going to do lymphatic work, we do want some support in there, right? Because we want the communication of those mast cells to be a little bit more normalized. So if somebody is helping flush your lymphatic through at a more efficient rate, we would like you a little bit stabilized. So as long as you're kind of working in tandem, right? Like what are we doing to stabilize the mast cells? Now let's work on your lymphatic flow. But it's an option and it does tend to work very well for a lot of people, especially those that aren't tolerating other treatments right now. You don't have to be doing your 10 physical therapy exercises every day. Your homework could be stabilizing your immune system by going to a lymphatic specialist once a week. So just something to consider. It's another way to work on the immune system is to find somebody that knows how to manually work on it. Okay, diet and mast cell activation syndrome. Surprisingly, maybe for some of you, I'm not going to talk about this for a long time, but I'm also going to explain why. Um, and I'll start with that diet is very, very individualized. And when you're dealing with so many other things, and if your GI is affected in different ways, you could already be limited in what you are able to eat. So I know that a lot of the talk out there are elimination diets for things that you're dealing with abnormal mast cell activity, taking things out, restricting things for a while and testing them. So I really don't want to go down that rabbit hole because it would be nice to stabilize you so that you didn't have to worry about food. However, if you would like to work with a dietitian or a nutritionist that specializes in abnormal mast cell activity, you all can talk about reducing those personal triggers in a healthy way, replacing them with other things. What are some food sensitivities? Do you have to take them out? Can we give you something to help reduce the reactions? And then, yes, we talk about reducing high histamine foods. But in the next slide, I'll talk about why that is so confusing. And food might not, for some people, be really the place to start. But reducing histamine might be helpful for some, and then low FODMAP diets as well, just because of what is also restricted in a low FODMAP diet. You actually get lower histamines for most individuals. So that might be a way to go for some. Um, for those who really don't necessarily want to take out because they have so much else going on, right? Or for those that are such high reactivity and they're already starting to clear some things out of their diet as a test, right? Maybe 4 to 6 weeks, let's reduce these things. And maybe take some DAO supplementation before meals. So DAO helps reduce that internal histamine type of reaction that happens when you ingest food basically into the body. So taking DAO supplementation before foods in general for those people that can't figure out what the heck they're reacting to, or for those that perhaps the holidays are coming up and they'd just like to have a little bit of cranberry sauce that maybe has been triggering before, then DAO supplementation might be something to take to help lower the reactivity of the system. So that can be helpful for some people in combining that with other treatment strategies. Okay, so here's the issue or the issues with considering an altered histamine diet. This is extremely confusing, and if you are thinking about this, please talk to a specialist. I just find that so many people that are even thinking about this already have so many limitations or can't figure out what they are sensitive or reactive to, that we really need a guide in this process because there are foods that in and of themselves contain higher levels of histamines. So the food will contain more histamine. And even considering that, the ripeness of food changes histamine levels. So, an apple sitting out longer, a banana sitting out longer is going to increase in its histamine load. So it's changing, it's dynamic. Then we have another group. So not even foods that when you put it in, you're going to get a high histamine type of reaction like tomatoes and spinach and things like that. Then you have what are called histamine releasing foods. So the food, when you eat it, is not necessarily higher in histamine, but causes a histamine type of reaction in the body. So bananas and avocados are some of those that can be found like in crossover groups like this. And then you have things that are called DAO inhibitors. And again, we need that DAO to help subdue those histamine reactions. But if something is inhibiting, so again, it's not necessarily a food that's higher in histamine, it could be, but it could be just a DAO inhibitor in and of itself. If you eat something that is a DAO inhibitor, it's going to reduce your body's ability to make that DAO or to have active DAO that's going to combat those histamine reactions that are happening. So this is why I say you have got to talk to a specialist or really take the approach in a lighter mode, right? So reduce histamine, take out big factors that you think are at play in the very high histamine groups. If you're having like vinegar and fermented foods every day, sure, lessen that up and see if it changes things. But taking things out can become very, very confusing, especially in histamine in general. So please work with a specialist that's familiar with mast cell activity and how all of these different types of histamine reactions happen in the body and change with food intake. So this is typically why I don't start with food, specifically with people with mast cell activation issues. However, for some people, food might be the easiest access with all the other things that they're dealing with. Like they don't want to do any other supplements or anything else. So if food is an option to play with and it seems a little bit easier in their case, find a specialist. Okay. So to start to bring this to a conclusion, we want to treat the mast cells, the communication. We want maybe some vitamin C, work on the appropriate mediators, right? Reducing inflammation overall would be wonderful just in our lives, calm down the immune system reactivity. But then if you've tried all of the things that should be helpful for the diagnosis, and you've tried all of the things that might be helpful for the person, you've tried different mediator support and things like that, if you continue to have issues stabilizing, or it stopped working as well, or you come to a stabilized point and you don't want to necessarily take all those things to stabilize, then you might want to have a conversation with somebody as to why your mast cells are continuing to cause an issue. Even with abnormal connective tissue, we can still have things that rile up the mast cells within our connective tissue. Okay, so it's not that everybody with abnormal connective tissue is going to have chronic severe abnormal mast cell reactions daily. So can we bring people into remission? And that's why we would want to look into clearing out anything else that was not addressed through what we call the superficial treatment, like we were treating the mediators in the mast cell, what's happening on the tail end. But if it's more of a chronic viral load, or a toxin exposure, chronic stress loads, whatever else is influencing the immune system and causing the immune system to stay on its toes, can we help that? So that is probably a different specialist depending on who you might have in your area. But that could also be helpful to eventually not have to do daily treatment for abnormal mast cell activity. Not necessarily for everybody. It's not everybody's case, but I see many, many, many individuals, and I'm biased, right? Because in my office, typically people have tried everything or seen other specialists. But it's just something to think about, that if you get to that point and you have tried lots of things, but nobody's talked about this with you, that maybe you have that conversation with somebody to make sure that you don't have this abnormal immune system driver that's irritating the connective tissue, that's facilitating abnormal mast cell activity, right? So just something to think about for more of the long term. And I'll talk about it at some point in approaching detox, but I will say this isn't necessarily the place to start for those that are experiencing abnormal mast cell activity. I know it sounds counterintuitive, like, well, if you just have toxin load, why don't we just detox? It's because we've already caused an abnormal mast cell reaction. So if we don't stabilize the mast cell and the immune system first, then it's probably not going to go as we'd like to see. And we're probably going to have, these chronic Herx reactions. So we actually have to do it a little bit backwards, support the mast cell component, stabilize your immune system reactions, come back to the detox, do it very slowly. And then we might be able to come off of some of the mast cell stuff. So it's just a little bit about how my brain usually works with individuals. But just it's something very important to remember if you'd like to think long term, and these things haven't been looked into with you, it is a place to consider and to go. Okay. So in summary, mast cell intervention is highly individualized. You saw all the options. There's a ton of stuff to think about. And even what I showed you, again, this is based on the diagnosis. If we think you have abnormal mast cell activity, this is where we would think to start with you. But you are very unique and individualized, and it's worth a conversation with a specialist to figure out and at least guide you based on your story and what they're hearing you're dealing with, what they might recommend from what they've seen, from a number of patients, and their reactions. There is no one cure that fits all. Um, there are some people that sure hey, my doctor has me on the same thing as you. We're both doing great. I'm so glad that it worked that way for both people. But typically what we see is it's not a one size fits all. That yes, we have this idea of, hey, here's round one. Like I said before, mast cell stabilizer, vitamin C, antihistamines maybe is what they give out. And then from there, you continue the conversation over and over and over again until we resolve mostly all of those mast cell symptoms, hopefully, right? So it's an ongoing conversation that usually takes many months, even into years, to figure out the long-term solution for an individual. I feel like there's a lot of people that stop at short term. Oh, it reduced your symptoms. Yay. Okay. Have a good day. Well, is it continuing to reduce the symptoms? Have we gotten rid of all of them? Is there any more improvement that we can do? Those are the professionals that you want to find that are willing to continue that conversation, which means that there should be an open dialogue throughout the treatment process, to figure out the symptoms currently that need to be addressed and over the course of time as well, and especially how they respond to treatment. I tell people, unfortunately, everything is going to be trial and error. I am never offended if you tell me something didn't work or you really hated it. Providing the feedback of what you felt and the symptoms that you had being on something might actually help expand the provider's idea of where to go next with you. Good providers. So, so negative feedback of this didn't work, this is why, can actually be really great to figure out what might be better in the future. And it's a dynamic process, and the individual that is dealing with mast cell activation syndrome really has to figure out over time what things seem to work with what symptoms, what are the order of things that seem to kick it out for them? Was it mostly vitamin C? What is it? Whether they have to write it down or they just have good memory in thinking, well, oh my gosh, yes, it was the mast cell stabilizer, and then I put vitamin C in there, and then I just had to do hydroxyzine or famotidine or even holy basil, and that combo for a couple weeks after I had that virus just kicked it all out again for me. That might be the tools to go back to. We want to teach people tools of what worked, when, and why, so that you can take that out of your file one day. As many of these conditions with connective tissue pathologies, I believe that we can bring people into remission, but we have to give them the tools to be able to combat something if it comes up. Because again, we can bring you into remission, but having a connective tissue pathology can make you more prone to reacting to stressors placed on your body, environmental, viral, whatever it might be. So if we clear up this mast cell activation syndrome issue now for you, I can't promise that you're not going to run into a virus one day and have a reaction from it, but you know the tools to start up sooner rather than later to hopefully not have a more chronic response from it. And that's really the goals that we're looking for when working with individuals with mast cell activation syndrome, is teaching them tools now and in the future that can be helpful. Lots of references. And these are actually all of my mast cell references, but the ones that I quoted are on the individual slides, and you can reference back here if you want full articles. But I like to keep all these together too, because if you really love mast cell stuff, these are a lot of my mast cell references that I use to talk about other things and crossovers in the presentation, if you would like to have more information on that. Okay, well, again, these approaches don't work for every single person that's out there, but this is kind of the standard, how we go about thinking about treating mast cell activation syndrome as like a first round before we get into individualizing treatment with the individual in the future. So hopefully it was a little bit helpful. Thanks for sticking around.